United anconeal process in a German Shepherd. So this dog presented 3 years of age with a chronic intermittent lameness for about a year. And radiographs were taken which showed a very prominent, very obvious right-sided ununited anconeal process. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So the approach here, this is the epicondyle right there. And basically what I'm going to do is I'm going to cut through the anconeus muscle, which is right along the back here. So I'll just make a curvilinear incision like this. I don't need light handles, all good, thank you. So curvilinear incision, and basically we're just going to follow exactly this curve of the incision right into the joint. So there's often a little delay, so it's probably about a 10-second delay.
Hello from Egypt.
Yeah, so if you guys want to just let me know where you're watching from. So just to review, this is a 3-year-old German Shepherd with a chronic right forelimb lameness that was shown to be an ununited anconeal process on radiographs. Can you just keep some pressure there for me, please? And so we're going in, and it's basically, it's too late to try to reattach it. If you have a really young dog without a lot of degenerative joint disease, you can try to reattach the fragment, but in an older dog, already has a lot of arthritis, reattaching the fragment, number one, it doesn't often want to heal, so the fragment often refractures. And number two, it doesn't really make any difference to the outcome. All right, so there are lots of little pesky blood vessels here. Okay, so just through another layer. So this is just connective tissue. And we will see the possibly the ulnar nerve. And we obviously are going to be careful not to cut that. So that's the anconeus muscle right there. So I'm just using the cautery to cut through that because it is very vascular. So that's, you can see the fibers of the anconeus muscle right there. Dog's getting a little light, just so you know. We've got Townsville and Wagga Wagga. Hopefully we'll be able, just might have you hold on to that, please. See the, so that's joint capsule right there. And we're through the joint capsule and we should have some synovial fluid coming out, which we do. So that's in the joint right there. I'll just get my Gelpi retractors in a little bit deeper. Jermaine, if you want to come around this side and think you'll see better, you're welcome to. So we're in the joint. Just hold on to that for me, please.
This one.
Yeah. Can I get suction turned on, please? All right, so we can see that nice reticular cartilage, and we can also see some osteophytes there as well. Grab another little Gelpy here. I can already see this big fragment. Alright, so let's see what I can do to try to increase my exposure. Just lift it up like that. Try to get your hand, one hand underneath there. Thank you. Lift it up a little higher. Now the challenge here is going to be that this fragment is so big that it's going to fight me coming out. Can I please, I've got a pointed reduction forceps here. Let's see if I can grab onto that. Okay, and here it comes.
Oh. That's attached to...
Yeah.
Hi from Canfield, from Wagga Wagga.
So that's pretty good. How's that for a fragment right there? Lovely. All right, so can I get my bupivacaine, please? Bupivacaine, please.
Are you right? Want to know what will happen?
All right, so I'll just flush this out. And we have warned the owners that this is not going to reverse the degenerative joint disease, and in fact that DJD is probably going to continue to form. So this is just going to provide some acute relief and improvement of clinical signs. We've warned them that DJD is going to continue to form, and that we'll have to continue to manage that as well. So I'm just going to do a bupivacaine splash block.
Dose is 12 mils.
Okay.
So you close your vesicular.
So I'm just getting our bupivacaine. Okay, and I'll take a needle, please.
What size do you like?
22. So that's all degenerative joint disease. So all osteophytes sitting right there, and we've got a lot of synovial proliferation on that joint. So I do use electric cautery. The brand that we use is Covidian. I have never seen a burn to my knowledge, but it certainly is reported. So I'm just injecting bupivacaine into the anconeus muscle, into the joint, and I'll save some and inject it into the skin as well. Can I please get some 2-OPDS? And we don't need to close the joint capsules separately.
So you close it with the muscle?
Yeah. Yeah, thank you. So we'll just close the joint capsule and the muscle in one layer. So that was very satisfying.
Yeah. Is that the biggest piece you've seen?
It's pretty big, yeah.
Do you still want the elbow picture?
You can drop that down, thank you.
Do you want me to cut?
Sure, thanks. Just run that for me, please. Thank you.
Almost done. Oh,
Thank you.
If the piece was smaller, could you have done it like with a scope?
It's, I haven't found, so the question internally, for those of you that are watching, was could I have done this with a scope if it had been a smaller fragment? And I really don't see a lot of advantage because the incision that we make is not that big. I'm not cutting through a lot of really important structures, and visualization is not a major concern here because basically we're just trying to get the fragment out. With fragment and medial core node process, the approach is actually quite significant, and we need to really evaluate the inside of the joint to see what the health of the cartilage looks like, and you know what the distal humeral condyle looks like, and that kind of thing. And so that's the real advantage of arthroscopy in addition to being minimally invasive. I'm sure somebody has done it arthroscopically, but I'm not sure that it offers a lot of advantage.
every day. So one thing we wonder is I think for a 6 o'clock PBR but yeah, been very interesting, really. Very what? Quiz. Oh, cool. Right, go to YouTube.
And guys, we are heading down for post-op x-rays,
Yeah.
just to
Can you, when you go out,
document that we've removed what we thought we removed.
amazing. Thank you. Let me know if you've got questions. Let me know what? If you have any questions. Okay.
So just doing intradermals here. you.
All good. You got any suction on it anymore?
I don't, thank you.
Do you want me to put that fragment in a pot or something else?
Yeah, we can give that to the honors.
Do you need anything else off the table?
No, I don't. Just the Marcane.
Okay.
And this dog is fairly hard to handle, and so I definitely don't want any skin sutures. Thank you.
You don't do the Aberdeen?
I do sometimes, yeah. Alright, so now I'll just inject some bupivacaine along the skin incision. And that'll dissipate in the next 20-30 minutes. So. Okay, so I'll just come back and make sure I haven't missed any questions. So there's a question, what's the difference between screwing it back on and then removal? So screwing it back on, if it's at an age where we think we can get it to reattach and there's not a lot of degenerative joint disease, then it's worthwhile trying to reattach that with a lag screw. However, when you have an older dog like this, 3 years of age with a lot of degenerative joint disease, then it doesn't make sense to try to reattach it. There is no bone that regenerates, and so basically what happens is that it just stays in empty space, and so you do have some instability in the joint associated with the lack of a joint surface, and that's why you have progressive degenerative joint disease. But having that basically a big rock in the joint is what's causing the acute pain, and it's not providing any support to the joint, so removing that can be a big relief, at least in the short term. And just making sure. So post-op surgical laser therapy, there's a question about whether that accelerates wound healing, and there are studies that showed that it does accelerate wound healing. It's not something we have available at our practice, but certainly if you had it available, it'd probably be worthwhile doing. So Savannah, Georgia, Wagga Wagga, Townsville, Egypt, and I think that's about it. So if you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding in your phone the next time we live stream. Thanks a lot for watching. We'll see you again soon.